I think it's important when thinking about combination strategies in kidney cancer to have a bit of historical context as well. If we think of where we came from in kidney cancer, not that long ago in the 90s, where cytokine therapy really dominated, the median overall survival was only around 1 year. And if we look at the current era of combination strategies, we're approaching 5-year median overall survival for patients with advanced kidney cancer. So it's this tremendous advancement, but a lot of room still to go. And I think that's one of the things that we learned with the abstracts presented here at ASCO. If we look at in the first line setting, 2 abstracts presented long-term follow-up for IO TKI regimens, which again showed tremendous benefit early on, great response rates, really big improvements in progression-free survival, and still improvements in overall survival, but as time has gone on, those have become a little bit more modest, suggesting there might be an issue with durability that still needs to be addressed for patients with kidney cancer, particularly when we think in contrast to pure immunotherapy-based regimens, which when someone gets a response, often those are really durable, long-lasting responses that are lasting 2, 3, 4, 5 years later. The other challenge that was sort of posed today in kidney cancer is the idea of what to do after a patient progresses on an anti-PD-1 based therapy. And that's what the CONTACT-03 trial really tried to address. Is it appropriate to just give a standard TKI therapy by itself, or to give that together with a rechallenge of an anti-PD-1 based therapy? And I think we learned today that there's always nuances, but for most patients, we should not give an IO rechallenge as a routine matter. There was no benefit in terms of response, progression-free survival, or overall survival, but we did see significantly higher toxicities. So a landmark study that really changes practice, but a negative study that really shows a caution that something we should not routinely do.